Thank you for joining Community Health Program's training session for community health workers on building outreach capacity to empower communities towards obtaining the highest possible vaccination rates against COVID-19. The goal of this grant is to address COVID-19 vaccine hesitancy. We hope to help you feel more confident and comfortable talking with patients and community members about the COVID-19 vaccine. We will provide you with the facts, what we know, and also what we don't know. Through this effort, we hope that patients and community members will have access to the facts and tools that they need to make an educated decision about their health. Everybody should make their own decision about receiving the COVID-19 vaccine. The role of the community health worker in vaccine outreach is critical. The community health workers meet people where they're at, physically, mentally, socially, financially, and emotionally. Community health workers are trusted messengers. They build trust over time and through shared lived experiences. They conduct outreach via TV, on the street, person to person, in the phone, in communities, and through things such as Zoom events. They can create and share culturally tailored educational materials. This ensures that the message is culturally appropriate and can be understood by those that we wish to receive that information. They represent and recommend local voice and images. They interpret and translate information. They meet local community literacy levels and understanding. Last, they serve to bridge to the community and to organize through their community connections by mobilizing trusted spokespeople and community influencers, and by conducting groundwork and grassroots work so that such initiatives can flourish. Community health centers, working with community health workers, can leverage prior trust and capacity that's been built over the years. These long-standing relationships can help to further the agenda of addressing vaccine hesitancy in vulnerable and underserved populations. Community health workers can also assume many roles. They are facilitators and advocates. They can assist community members with making appointments and getting to appointments. They can assist communities with finding vaccines. They facilitate listening sessions and then bring information back to key agencies. They serve as the interpreters and translators of health education materials, considering various dialects and cultural nuances. They serve as health educators on COVID-19 vaccine basics and system navigation. In general, community health workers are important community influencers. In addition, it's important to consider the organizational level things, such as information, involvement, and investment. Effective communication, listening and learning, and framing the conversation in the community's own terms provides the best quality information to our patients and communities. Many folks hesitate to receive the COVID-19 vaccine. One mass polling group rolled out a vaccine hesitancy survey. It was statewide in the month November of 2020 and included responses from 1,180 residents of Massachusetts. For a large majority, vaccine uptake is a matter of when and not if. It boiled down to social proof. Many felt, I'll do it if others do it. But the poll also signaled major risks around inequities. Doctors were found to be the most trusted messengers, but everyone, including each of us, has a role to play to ensure we have swift and equitable vaccine uptake in our communities. A wide range of concerns can lead to vaccine hesitancy. Some of these concerns exist due to historical and current systemic racism, a distrust of the government, misinformation that's circulating in news and media outlets, vaccines in particular, cultural context, and general uncertainty. The top 10 concerns about the COVID-19 vaccine are as follows. 1. That the vaccine hasn't been tested thoroughly. 2. That folks do not trust the government on healthcare-related issues. 3. That folks do not believe that the vaccine was developed safely. 4. Folks are not convinced that the benefits outweigh the risks. 5. Folks do not believe the vaccine will be affordable. 6. Folks would not know where to go about getting the vaccine. 7. Some folks prefer natural remedies over vaccination. 8. Folks don't trust vaccines in general. 9. Folks do not believe that COVID-19 is real. And 10. Some folks have religious objections to this vaccine and other vaccines. The CDC, or Centers for Disease Control, shared 6 ways to help build COVID-19 vaccine confidence. First, encourage leaders in your family, community, or organizations to be vaccine champions. 2. Have discussions about COVID-19 vaccines where people can openly discuss their views and ask questions. 3. Share key messages through multiple channels that people trust and that promote action. 4. Help educate people about COVID-19 vaccines, about how they are developed and monitored for safety, also how individuals can talk to others about the vaccines. 5. Learn more about finding credible vaccine information. When you come across COVID-19 information, cross-check with cdc.gov and learn how to respond to misinformation you may encounter. And 6. When the vaccine is offered to you, make visible your decision to get vaccinated and celebrate that decision. We suggest the following educational strategies in addressing COVID-19 vaccination hesitancy in the folks that you work with. First, what type of education is found to be effective? You can try fact-based education. Honesty builds trust. You can address questions that are unique to a specific population or community that you are connected to. Be bidirectional in your communication efforts. Inform the system of what you find and also the community that you serve. Be encouraging. Be positive. Support this effort collectively. Some outreach methods that you might try are one-on-one education. This could be via phone, in person, digital, or through e-newsletters. As well-connected neighborhood individuals, you could also try canvassing. You may want to try areas that are hardest hit in terms of vaccine hesitancy or those with unique barriers to receiving the vaccine, for instance, being located far away from the mass vaccination sites. This could be done in a door-to-door way or just general street outreach in your travels and other work. You can also try to partner with businesses and other local entities where folks congregate and often visit. This could be barbershops, corner stores, or faith-based organizations. One great platform to leverage would also be social media, which would include videos, public service announcements, and the use of hashtags. Another strategy for reducing vaccine hesitancy is motivational interviewing. Through motivational interviewing, a community health worker can explore with the client their own hesitation to change. This gives the client a chance to talk through both sides of their own internal argument about change and life pattern without judgment. The motivation to change comes from within the client and is not imposed from externally. These types of encounters guide a client towards a resolution that stimulates the change internally. This allows the client to follow their own timetable and not ours. There are certain ways to simulate change talk. Some ways that you can bring about change talk include asking a suggestive question, such as, "How do you see it?" Next, you can explore decisional balance, asking people to elaborate or to tell you more about their decision. You can look backward and forward. For example, what has worked in the past? Where do you see yourself a year from now, 2 years from now, or even 5 years from now? You can query the extremes. What will happen if I continue this way? You can also explore goals and values. So, what's important to the folks that we are working with? Certain language helps to improve vaccine acceptance in the folks that we're working with. Vaccine hesitancy and vaccine acceptance are not a static state. People move along a continuum of both. People may be accepting of one or not the other. Our role and our hope is that we will be able to sway those who are on the fence. Some tips for communicating on vaccines: focus on the benefits of success, not just the consequences of failure. We understand people are tired, but public health measures are not the enemy. They are the roadmap for a faster and more sustainable recovery. Scientists and medical professionals are preparing to distribute a safe and effective vaccine that will help us return to normal day-to-day activities. Emphasize that the science is settled. The science is clear. There is no doubt that mask wearing, hand washing, and social distancing reduce the spread of COVID-19 and save lives. Don't expect people to take public health measures because it's good for them. Speak to the consequences of not taking these measures so they understand the full effect. Because COVID-19 is highly infectious, one infection can quickly grow into an outbreak that will shutter a neighborhood, community, or entire city. This is a community effort, not just an individual consideration. Use these words more in your discussions with folks. The pandemic. Eliminate, eradicate, get rid of the virus. Social distancing. An effective and safe vaccine. Protocols. Face masks. Essential workers. Personal responsibility. A stay-at-home order. Public health agencies. And policies that are based on facts, science, and data. Try using these words less. The coronavirus. Defeat, crush, knock out the virus. Physical distancing. A vaccine developed quickly. Orders, imperatives, decrees. Facial coverings. Frontline workers. National duty. A government lockdown or shutdown. Government health agencies. Policies that are sensible, impactful, and reasonable. The language that we use can impact how we're able to communicate with our communities. The CDC does not recommend one COVID-19 vaccine over another. They suggest getting the first vaccine that's available to you. The 3 vaccine brands available in the United States are Pfizer, Moderna, and Johnson & Johnson. The Pfizer vaccination is available to individuals 12 years and older and is given in a series of 2 shots that are 3 weeks apart. The Moderna vaccination is available to individuals 18 years and older and also is given in a series of 2 shots. However, they are spaced 4 weeks apart. The Johnson & Johnson vaccine is available for individuals 18 years and older and is a single shot dose of the vaccine. There are many myths that are circulating around the COVID-19 vaccines, which lead to vaccine hesitancy in many different individuals. It is important to review information on each of those myths so that you can address those questions with individuals when they may arise in your discussions. Please see some of the major myths here on this page or consult additional information available by clicking the link that cites the source on this slide, or just visiting cdc.gov for further information. Over the next few slides, we will emphasize some key facts and findings from our trainings that we hope to impart with you all that can then be shared with our communities at large. Key facts. All state residents are eligible for the COVID-19 vaccine as of April 19th, but some people remain at higher risk of severe COVID-19 than others. Vaccines are free, but insurances may be billed as appropriate. All of the vaccines are equally effective against severe COVID-19, including hospitalizations and death. If vaccinated, you still need to practice the same public health precautions of social distancing and mask wearing as directed by local public health officials. Vaccine side effects mean your immune system is working, but if you do not experience side effects, it does not mean that it is not working. People who are considered high risk still can become very sick and die of COVID-19. People who have had COVID-19 should still get vaccinated. Key concepts. Talking about timeline, building trust, sharing safety information, and describing processes will help to build vaccine confidence in our community. Community health workers have important roles in the community health center team, including facilitators and advocates, interpreters and translators, and health educators. Systems navigation and cultural responsiveness are critical to build vaccine confidence. Understanding community health center and community vaccine operations at the patient experience will help you to put patients more at ease. Educational tools and resources can be accessed at https://massleague.org/programs/covidvax/index.php. If at any time you have questions or need further assistance or clarity, please contact any of CHP's community health workers. This includes Jenna Bodnar, Melanie Wickwire, Octavio Hernandez, and William Cruz. As part of this grant, we are required to submit certain reports to reflect the great work that the community partners are doing collaboratively in this regard. The Mass League of Community Health Centers requires CHP to report on progress every 2 months. We want to make sure that these reports reflect and credit your hard work. For the progress reports, we are looking for important information on outreach strategies, materials, and what concerns are people you are serving voicing, and what barriers are the people you are serving facing. To support you, our partners, in fulfilling these reporting requirements, CHP has created a spreadsheet to help record the information we've requested each week. There are checkboxes for outreach strategies and materials that you can use, and space for you to note such observations, any ideas, concerns, or barriers. At CHP, we thank you for partnering with us on this important initiative to improve vaccine confidence in our community.